Hello and welcome to this video. In this video, we're going to bust some myths regarding immediate dentine sealing. If you are doing bonding, if you are following Pascal Manier, then you know about immediate dentine sealing. We know that we want to seal that freshly cut dentine in order to improve our bonding strength, improve that hybrid layer, because we know that if the dentine becomes contaminated, it's very difficult to get that nice quality hybrid layer. And that's where the immediate dentine sealing concept comes from, where for indirect restoration, when you are preparing the tooth for indirect restoration, and from the time where you prepared and to the time when you are fit the indirect restoration, you want dentine to be contamination free. Even if you're doing same day restoration, you have still few hours of lag, and that could be enough for patient to dentine to be contaminated. And that's when we do immediate dentine sealing, where we etch, prime and bond, usually using 4th generation bond like OptiBond FL, highly filled bond, and seal that dentine before you take the impression and make the restoration and fit the restoration. So there are some questions I get asked on a routine basis, and I thought I'll make a video in order to explain it to dentists, to just bust some myths. So one of the questions I get asked is, do I need to always use composite if I'm doing immediate dentine sealing? And the answer is no. As the term suggests, it's immediate dentine sealing. You don't need to use a composite on top. However, if you're blocking undercuts, if you're doing deep margin elevation, then yes, you're going to use composite. But that's got nothing to do with immediate dentine sealing. Immediate dentine sealing is really for sealing of the dentine. And then you decide whether you're going to use composite or not. If the tooth is flat, you don't need to build it up, then that's it. You don't need to use composite. The other question I get asked is, can you use any bond if I'm doing IDS? And the answer is yes and no. Yes is because, yes, you can use any bond. The problem is that if you use a bond which is highly unfilled, then it's very thin and it doesn't give you thick enough layer, which is better, because we know that you have around 40 micron oxygen inhibition layer on any composite or any bond. Now, if your bond thickness is 11 micron, then you can never eliminate that oxygen inhibition layer. Those bonds are not meant to let it expose. Those bonds are meant for composite to put on straight away. And that's why if you're using unfilled bond, then you need to use some composite on top in order to cover that bond, so that you don't, when you're polishing and cleaning everything, you're not taking that bond away. And that's when you need to use composite. However, if you use filled bond or highly filled bond, such as OptiBond FL, you don't need to use any composite liner on top. And because you can get up to 80 to 120 micron thickness of the bond. So make sure that if you are using bond which is unfilled, you put a composite on top to protect that hybrid layer. But if you are using OptiBond FL, then you don't need to do that. The other question I get asked is, it will affect quality of my impression. And yes, there are some studies which showed that, if you leave uncured resin, it can affect the quality of the impression. However, what you are going to do is, once you have cured your bond, you are then going to use glycerin to remove the oxygen inhibition layer, cure it again, and then you're going to use pumice to polish the preparation and remove that little bit extra inhibition layer as well, just to make sure it's nice and polished and there's nothing residue left on top. And again, I've been doing this for a long time to tell you that no, the impression doesn't get affected. Of course, if you're doing digital impression, then that solves the problem of conventional impression. But even if you're doing conventional impression, it doesn't really affect the quality of impression. And lastly, I get question asked that IDS will affect the fit of my restoration, because if you are putting bond which is, let's say, 80 micron thick, then how will my restoration seat if it's on the margin? And the answer is, just don't put it on the margin. So I make sure that if I am doing veneer, let's say, I use a probe to just cover the dentine area If the dentin is exposed on the margin, I personally do not put bond on the margin. I want the margin, my restoration to directly go to the margin. And at that point, I do not put bond, because if you're using OptiBond FL, then there is a risk that you are going to create a thickness in the margin and your restoration may not be able to seat, because your impression won't capture the margin if the bond is in a way. So use probe or very small micro brush, but usually probe's much better to apply bond very carefully, which is away from the margin. If you think the bond has gone to the margin, then just use a burr to refresh the margin. After you've done IDS, you should be refreshing the enamel anyway, just in case if you think that the bond has gone onto the enamel, because it's immediate dentin sealing, it's not immediate enamel sealing. We want fresh enamel. You don't want enamel to be bonded on the prep appointment. So I hope you found this video useful. If you have any question, please feel free to contact me.